Okay, Canada, it's now time to be all hands on deck when it comes to tackling this coronavirus that is besieging a whole bunch of countries around the world and is increasingly closing in on us here in Canada. I'm not going to bother doing an update on the latest because as soon as you write a column, post a video, issue a tweet, 10 minutes later, there is new information. Things just seem to get crazier and crazier day by day. In Canada, we know there's some really worrisome reports out there of one doctor in the Hamilton area, a cancer doctor, an oncologist. She got it while traveling. It's believed to be around Hawaii. She's met with cancer patients, people who have compromised immune systems. A child at a daycare facility in Calgary has it. What is the spread like in that area? Yes, we're told that this virus does not affect children as much as it affects adults and the elderly, but still, who knows? You want to minimize all of this as much as possible. Now, a lot of experts out there, epidemiologists, infectious disease experts, they're saying, look at the curves of countries that have brought in drastic measures. China, Iran, they were not able to do that early enough, but there are other jurisdictions that have, and it proves this sort of stuff works. Look, my take is that some sort of clampdown is inevitable in Canada. So let's get it over and done with. Let's do it sooner rather than later, because doing it now, doing it earlier, does a number of things. It can reduce the caseload, reduce the amount that the system is feeling taxed by this. We're already hearing reports of hallway healthcare in Canada before this, places in Quebec, places in Brampton, in the Greater Toronto area. We're really at capacity in our healthcare system as it is. How are we going to deal with a surge of these cases? We just don't know. So bringing in measures sooner than later is the wiser thing to do because it means slowing it down, saving lives. Now, of course, we could bring in all these measures and things could not become like, say, they are in Italy here in Canada, and it could pass us all over. And people could say, well, there, look, you didn't need to do it. No, I think that would be evidence that this worked. Now, I know there's been a lot of divided opinion on this. A lot of people have been seeing my tweets, my videos, listening to my radio show and saying, nah, this just really isn't all that bad when you compare it to other death rates, other infection rates. Maybe, and I would love for that to be true, but right now we do not know. We are told listen to the experts, but there's a problem. There's no such thing as a coronavirus expert. There are infectious disease experts, flu experts, and so forth, but right now the experts are in disagreement over this, and they are grasping to answer basic 101 questions about what is this thing and exactly what does it do to people and how do we get it under control. And even if they do have all those questions answered, there's still that little problem of there being no vaccine, no treatment for it yet to be viable. Yes, there is the regular flu, which really only kills people who are on their way out anyway, people who are unfortunately very compromised, or there is the Spanish flu of 1918, which flared up in January of that year, and it chugged along and it only killed the elderly and it killed the vulnerable. It went away during the summer and then it came back in September, October, November with a vengeance and started killing young people in their prime, in their 30s, in their 40s. Is that what's going to happen here? I don't know. Maybe. Can you tell me for certain that is not what's going to happen here? I would like to think no, because this is 100 years later and we have such an advanced system, much more better public health protocols, medical researchers who work a lot faster at these things. We're just a cleaner, more hygienic society, but we don't know. And that's why we need to bring out all the stops right now. I am no fan of big government. If government says, Furey, stay at your home, there's a part of me that instantly wants to go out and dance around in the streets just to say, screw you, government, you can't tell me what to do. But it's pretty obvious that we are in a very different situation right now. We are in a race, really, for our health and a race to save lives. Whatever measures we think are coming to Canada imminently, I say bring them in now already. Get it all over and done with. Pull out the stops sooner than later.